This is Scotty, this is my dog, and today's topic I'd like to focus on something that's very dear to me, and that is about what's happening in the present healthcare system. Not only am I a direct marketer, and I've been in this business since '83 and have had some very good successful businesses and continue to grow successful businesses, but one of the things dear to my heart is being trained as a medical doctor, surgeon, and as a board certified urologist. Why am I compelled to give you this message today? This message goes out to those that are in the healthcare profession who are asking the question as to what's going on and what's going to happen to my future. Will I be in federal hands? Will I lose my ability to manage my own life? Will I lose the ability to make income as I was promised because of all the money that I spent on my medical education? What's going to happen to me? Am I going to be an indentured servant? These are things that I hear in the doctor's lounge. I hear it over the radio. I read it in the newspaper. Even with the recent election of Senator Brown in Massachusetts, you're hearing more and more conversations come up as to what's going to happen to healthcare in America. Doctor, one of the things that you got to understand in life is economics. For most of us that wear that sacred white jacket, we have no idea about finances. Do you know in my town, the hospital administrators make millions of dollars a year? And on top of that, those same administrators of these non-profit hospitals walk out the door each year with multi-million-dollar bonuses. Now, for most doctors in your town, you probably have rarely heard of them taking bonuses or walking out with million-dollar salaries. Now, taking care of human lives is a very, 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 very unique skill. Only a few are chosen. My take to you, doctor, is this. If you are in a business where you are billing out to third parties to pay for your services, then you are in a killer man business. Killer man meaning that you have no control over what the third party will pay you, and you have no control over your end product. I can say for assurance, most people think that for urologists, we make thousands and thousands of dollars when we do kidney surgeries and prostate surgeries. Most people are startled to see that we are reimbursed for less than $1,000, and that creates a 3-month global. Most of our patients and clients don't understand a 3-month global means you're paid one money in your practice that covers all the expenses surrounding that patient's visits and their services for 3 months. So here's an opportunity for you to come inside to MLMtraininghighway.com and let me show you how I've taken my direct sales businesses and created revenue streams far greater than what I do in a medical practice. If you haven't heard of names such as Cedric Harris, Brian Fennell, David Wood, Jeffrey Combs, Robert Sheeman, then you're on the wrong team. These are young people around the country that are making 7-figure incomes, and many of them are less than 40 years of age. Many of you have practiced medicine for considerable years and have yet to make your first $1 million. America is a country of wealth builders, of dreamers. Yes, it is still possible to make good income and to make a good living in America without going broke. I urge you, my fellow practitioners of medicine, we can deliver a good health care plan to America without being the sacrificial lambs. We need to learn how to teach one another to build wealth independently so that we can amass money to lobby senators, congressmen, to amass money to lobby for presidential campaigns. because of the income that most doctors get from their practices, which are controlled by the insurance industry, with all the taxation that comes from the federal side, you take very little of your money home. You work endless hours. You carry a pager. You carry a cell phone. You never detach yourself from your business. Come inside so that I can help you and show you how I've been enjoying the summer suns and the life in Florida while decreasing my commitment to the healthcare craziness. When will it change? Will it be in the next 5 years? Will it be in the next 10 years? Where will you be? My message is to your heart. Come out, come inside. It's very simple, and we can teach you these techniques of how to create ancillary businesses for you and your family so that you can enjoy those things that you saw when you were a visionary as a medical student, spending over $200,000 for medical career education and more to make less and to work harder than any other American citizen that works professionally. And that's taxed more than any other American citizen that works and manages their business. Don't be afraid of tomorrow, because the good thing about America, America has always represented that beacon, that light. Americans have always been successful. And even when we think that we're at the bottom and that our country has reached an all-time low, that is when America picks up the bootstraps and we teach other Americans that America is a wealth-building machinery. Let's get busy. Take action with me. Ernest A., your doctor on the internet. Thank you.